Kirby Thompson, owner and operator of Wildflower Wellness, licensed naturopathic doctor and acupuncturist, and I'm here today for Dr. Kirby's Pick. And for Dr. Kirby's Pick, I'd like to share some information about psoriasis, if you will. Psoriasis can be a very complex malady that can cause a lot of suffering for 2 to 4% of the American population, which is actually quite high. There is one thing that is usually present in most cases of psoriasis, and that is stress, emotional issues, and anxiety. When that nervous system gets jacked up, it makes all the body systems really not work how they're supposed to. And for some people, because of what's happening in the body, it can come out on the skin as psoriasis, right? That's true. So psoriasis is actually called a hyperproliferative condition. What does that mean? Hyper means a lot, right? Proliferative means divide, right? So the cells divide at up to, and maybe even surpassing, 1,000 times their normal rate in areas where they are. The patches are. It's usually dry, scaly patches. Sometimes they pus. Some people have on their head, elbows. I actually have had this condition on my hands and my feet, where the skin just sloughed off. There's not a lot of help for people in a mainstream medical realm. There's steroids. People use rheumatic drugs, autoimmune type drugs, which can cause some problems. There are a lot of side effects. But the skin on people who actually have psoriasis in areas that are not affected can still be dividing at an even higher rate than it's supposed to in other areas, 1 to 2.5 times. That's just was interesting to me when I was looking up statistics and stuff like that. So what we have to consider is what's going on in your body, and that's where the information comes in. What can be causing this? What do we need to do? What do we need to address in order to make sure this is going to go in a good direction? Take into consideration, if we do not address that stress, emotion, and nervous system, a lot of times it's going to be harder to resolve. Now, also, this condition can be genetic. There can be a genetic part to it. Now, it can be very treatable, but you have to get to the root, and it can take some time to clear out. Sometimes it's just a turnaround. And personally speaking, when I had the psoriasis on my hands and my feet, I would have to wrap I didn't know any of this stuff like I know now, but I would have to wrap my hands and my feet in saran wrap with steroid creams at night in order for that to just feel better. So I really understand psoriasis, how it feels to other people. Now, when I get under stress myself, or my life starts to get a little bit topsy-turvy, I actually will have a little patchy spot that will come up here, and then I know, oh my Lord, something is happening. This is bad. So, start addressing both the determinants of health, right? Food, water, rest, relaxation, that kind of thing. Exercise, movement, but also internally. So what do we look at internally? And this is where the information comes in. Number 1, we look at incomplete digested protein. If you are not breaking down your food, then it's going to cause problems in the gut. Your immune system's going to go haywire. And there can be imbalances in the biochemicals that can actually you get small intestinal bacteria overgrowth, bacterial imbalances that can cause real havoc. And remember, that can cause a higher toxic load, because where do those toxins come out? Well, they come out in the kidneys and the bowel. But if your gut is not working, then it's harder to get out. And number 2 is bowel toxemia. Again, toxins. These can be candida. They can be IgA, IgG, immune complexes. The immune system starts fighting, and once it starts fighting, it sends out these chemicals to tell the body what to do, right? Where's the inflammation? What's going on? And then, of course, the bugs, the bacteria, fungus, all that, they actually secrete toxins themselves. So bowel toxemia, I've had that too. Impaired liver function. In fact, in Chinese medicine, there are types of psoriasis that are liver blood deficiency, and that can be part of that can be not detoxifying properly, just not having enough cofactors, things to actually detoxify that liver. I am at my house tonight, so you may see my cats running around. You know I love my cats. People that know me know I love my cats. So, impaired liver function. We have to make sure in psoriasis that we address the gut, that we address the ability of the gut to bind, right? And I did find some literature that did talk about the incidence of low fiber and increase in psoriasis. Fiber is very important for binding, cholesterol health, diabetes, sugar regulation. Make sure that's one thing I tell people, usually a good idea. Now, if you have some gut issues to begin with, you got to be careful about the kind of fiber that you use. Make sure you see us, right, both online and in the office, and we can help you get that resolved so that you can start doing those types of therapies. Another one is alcohol consumption. Alcohol consumption is known to worsen psoriasis. So if you start getting, things, red spotches on the skin, well, your body is overloaded. The toxins they have to come out somewhere. So it's going to come out in the skin for some people, especially if you don't have good drainage pathways. Excessive consumption of animal fats. And I also have literature that said that, if your fatty acid metabolism is not doing great, remember you have to have that fatty acid right on the skin in order to look, supple, to make sure that it's healthy. Nutritional deficiencies are a place where people often don't go with their psoriatic condition. It is important that we recognize that this psoriasis can be linked to deficiencies of A, zinc, selenium, chromium, and glutathione peroxidase. And of course, as I've already said at least twice, stress. So these are major areas for psoriasis. Now in Chinese medicine, you were talking about there are at least 15 different kinds. Spleen blood deficiency, liver blood deficiency, spleen qi deficiency, liver blood with wind, dry, there's all kinds of different Chinese medicine diagnosis. It's a lot different, but you can be a little more specific. Now, Dr. Shea always said, if you have a problem in the skin, strengthen the blood. So we always try to do that. And of course, with the stress, you have to do the hormones. Remember, if you mess with one hormone, you mess with them all. And you have to have the blood sugar in line. Remember, insulin and glucagon are blood sugar related, and they are hormones. And they can affect estrogen, progesterone, testosterone regulation. That is a very complicated subject, but make sure that blood sugar is good. Now, those are your biggies. Ooh, one more Chinese medicine. Remember, the skin is thought to be the second lung. So we also have to look at the lung. And in Chinese medicine, the lung moves stuff, right? It's important. We breathe, we descend, and we detox through the kidneys, of course. So, these are some hot button words, very important. Psoriasis is linked to, and remember, all these are related to those 1, 2, 3, 4, 5, 6, 7 things that are really honing in on with psoriasis, and that is low gastric acidity, intestinal dysbiosis, abnormal immune response to intestinal flora. So I've had people actually who came in the office and they were having all these skin problems, and guess what we did? We took out the probiotic and it went away. Why? Because they were reacting to that intestinal flora. So, be careful. We can cause problems with what we're doing too. Elevated ESR, low zinc status, chronic candidiasis, need for detoxification, microbial toxins, right? And these can be associated with asthma, allergies, immune disorders, thyroid disease, lupus, pancreatitis, chemical exposures, food allergies. Oh, this can cause big time bowel toxemia. Because if you have food problems digesting your food, immune reaction to your food, then this may be, for a lot of people, once we take the foods out that they're having problems with and then balance the body, fine, right? But you have to address what people are eating. That is big. High levels of toxins all the time, high levels of toxins. So what are the strategies that we use? Well, again, it depends. It depends on what's going on. Like I said, we always have to address the adrenals, the stress, the hormones. Then we have to address the bowel. There are some great herbals. Golden seal is one that has been very researched and is shown to shut down some things in that gut, but there are others. EPA can help a lot. Omega-369. We've used evening primrose with this a lot, and it helps quite a bit. Quercetin. Again, it depends on why you're having this, and it's usually a step-by-step process. First, we have to open up the drainage pathways, regulate some hormonal neurotransmitter pathways, then we can go in for the gut. So if you have any questions, or if you have this problem, give us a call. We can help. Our number is 601-287-3837. We are www.wildflowerwellnessllc.com. And thank you for viewing. Please like us on Facebook, Instagram, and Twitter.